Welcome to the educational module, Early Identification and Isolation of Contagious Patients. It can happen in the emergency department triage. Contagious people frequently seek medical care in the emergency department. Thus, it is very important to quickly identify these patients in order to minimize the risk of spread to others. Please click on the arrow to advance the slide. There are 4 learning objectives for this module. First, this module will teach you how to identify patients with high risk and contagious infections. Second, it will review how to choose the most appropriate isolation precautions for the patients presenting signs and symptoms, even when you might not know yet what disease they have. Third, we will review why it's important to quickly inform the appropriate individuals about patients with suspected infections. And finally, we will review how you can protect yourself and others from infectious exposures while at work. You might be thinking, why is early identification and isolation so important? Well, let's look at an example of when early identification and isolation did not happen. Back in 2008, a 37-year-old unvaccinated Swiss traveler with classic measles symptoms visited an emergency department in Arizona. Even though she had traveled internationally and had the classic signs and symptoms of measles, fever, conjunctivitis, and rash, nobody realized she had measles. In fact, she visited the same emergency department twice and was not isolated either time. This led to a total of 14 cases of measles in one hospital over a 3-month-long outbreak. As you can see in the figure on the right, that woman infected another person who infected 4 more people, and on and on. How did this happen? Yes, you guessed it. Several patients were seen in the emergency department and were not placed in the correct isolation precautions. Take a look at the red arrows in the table on the right. There were 6 patients with measles who were all cared for in the emergency department, but none were appropriately identified and isolated. As a result, the outbreak continued on. So, how do we prevent this from happening? How can you prevent this from happening? It all comes down to 3 steps. And these steps follow an all hazards approach, which means that it won't only help you identify that person with measles, it will also help you identify the contagious person with tuberculosis, influenza, and even Ebola. First, identify. If you ask the right questions in triage, you can identify the contagious patient as quickly as possible. Second, isolate. If you isolate the patient, you will minimize spread to other people, including yourself. And third, inform. You should know who to notify when you think you have identified someone with a serious infection. It might be your supervisor, the emergency department charge nurse, your infection control team, or the triage nurse if you are a clerk. Your emergency department team will help to make sure that your patient is appropriately isolated while still providing the safe and effective care that he needs. Now we will dive a little deeper into each step. First, let's talk about how you identify the contagious person. The first step is to evaluate every patient for signs and symptoms of contagious diseases. For example, if the patient has a cough or sore throat, you should immediately give that patient a mask. This can be done where the patient first checks in with the ED reception desk. It does not necessarily have to be a nurse who asks this question. If the patient does have symptoms of acute infection, you can also ask if the patient has been exposed to anyone with a known contagious disease. Take note if the patient says yes. This can give you clues about what infection your patient may have and can also give you clues about what additional isolation precautions may be needed. Next, ask the patient if they have traveled outside of the United States. You might want to ask about specific geographic areas where contagious diseases are common or where outbreaks are occurring. This can help to identify high-risk diseases such as Ebola, MERS, tuberculosis, measles, or chickenpox. So, to summarize, when a patient arrives at the registration or triage area of the emergency department, first, ask about symptoms. Have you had a fever? Have you had a respiratory illness? Severe headache, rash, vomiting, or diarrhea? If the patient answers yes, then ask, have you been in close contact with someone who recently traveled outside of the United States and became sick or has a contagious disease? Second, ask about travel. Have you traveled outside of the United States in the last 30 days? Have you been in close contact with someone who became sick after travel outside of the United States? You might be wondering how to stay aware and updated about outbreaks going on. It is important to be aware of outbreaks in your city, your state, the country, even the world. Twitter is a great way to stay aware. Many organizations have Twitter accounts that you can follow and know in real time what outbreaks are occurring. Some suggested Twitter accounts include ProMed, Multnomah County, the World Health Organization, HealthMap, and the Oregon Health Authority. Next, we're going to talk about isolation. How do we isolate patients who may be contagious? First are administrative controls. This includes things like isolation precaution signs to tell healthcare workers and staff what precautions they must take before entering the room of the contagious patient. Second are infection control policies. Be sure to know your own hospital's infection control policies and find out what tools your program has to make your job easier. Next are environmental controls. This is how we control the environment to decrease risk of transmission. Airborne isolation, also known as a negative pressure room, is one way that we have environmental control of transmission. Always make sure that the airflow is truly negative pressure before placing the patient into the room. Finally, there are physical controls to help isolate the patient. These are important parts of standard precautions. Hand hygiene before and after patient care is the cornerstone of infection prevention. Appropriate cleaning and disinfection of the environment and patient equipment is also critical to decrease transmission. And finally, knowing which PPE or personal protective equipment to wear based on the work that you will do and the infection the patient has is critical. Personal protective equipment is used to protect yourself when caring for a patient who may have a transmissible disease. Gloves, goggles or face shield, a gown, mask or respirator are all important components. The goals of PPE are to protect the healthcare personnel from exposure and also to limit the spread of contamination to other patients and surroundings. There's 4 steps when you think about how PPE works. Step 1, think about the exposure risks before you start a task. Second, choose and put on the PPE components that will protect you. Third, do your task. You are now protected from exposure. And fourth, remove your PPE without contaminating yourself. So let's talk a little bit more about standard precautions. Standard precautions does not mean do nothing. It is a 3-step decision-making process when providing care to a patient. There are 3 questions you should always ask yourself before doing a task in healthcare. Question number 1, what does the patient have, and what is my exposure risk? Question number 2, what is your planned task? And question number 3, how do you protect yourself? Let's discuss a few examples where the 3-step decision-making process is used for standard precautions. First, what does my patient have and what is my exposure? Let's say you have a patient in the emergency department that has a large open infected wound with purulent drainage. Think about your exposure risk. That drainage could be loaded with bacteria like Staph aureus. Now, before you actually do your task, think about what you are going to be doing with the patient. In this situation, you're going to be cleaning the wound and then covering it with a new dressing. Step 3 is when you consider how you're going to protect yourself. So, if you're going to be cleaning the wound and covering it with a new dressing, you should wear disposable gloves, remembering to clean your hands before and after wearing the gloves, wearing an isolation gown, and, if appropriate for your facility, order contact precautions. In the next example, your patient has cough, sneezing, and a fever. So you think, what is my exposure risk? You could get coughed on. This could be influenza, pertussis, RSV, croup. Who knows what the pathogen is? Now that you've figured out your exposure risk, you need to think, what is your planned task? In this situation, you plan to check the patient's blood pressure. Now that you know your task, how will you protect yourself? You should wear a disposable mask, clean your hands before and after patient contact, don't forget to wipe down the cuff if it's reusable, and finally, order droplet precautions. Let's do one more patient example. If you have a patient with cough and any of the following symptoms, hemoptysis, weight loss, night sweats, and was born or traveled to a tuberculosis endemic area, what would your exposure risk be? The risk is that this could be tuberculosis, and the cough makes it highly contagious. So with this patient, what is your planned task? You plan to perform an initial triage evaluation. How will you protect yourself? Put a mask on this patient ASAP. He could be contagious. Place the patient in a private room and move to an airborne isolation room as soon as possible. And finally, order airborne precautions. Now, let's review the specific isolation precaution categories. The category used depends on how the infection is spread from person to person. The goal is to prevent spread. The first category is contact precautions. The PPE components for contact precautions include disposable gloves and a disposable gown. One example of when you would use contact precautions is if the patient has a highly resistant bacterial infection. The next isolation precaution category is droplet precautions. The PPE component for droplet precautions includes a disposable procedure or surgical mask. An example of a disease that requires droplet precautions is pertussis, also known as whooping cough. Another isolation precaution category is airborne precautions. The PPE components for airborne precautions is a fit-tested and fit-checked N95 mask or a PAPR. Some examples of diseases that require airborne precautions are tuberculosis and measles. Finally, sometimes we combine more than one isolation precaution category. For example, oftentimes the combination of contact and droplet precautions are used. The PPE components for contact droplet isolation include disposable gloves, a disposable gown, and a disposable procedure or surgical mask. An example of when contact and droplet precautions are indicated is infant bronchiolitis. Let's look at a few more patient examples to determine which isolation precaution category is appropriate. If a patient with a left-sided rash has vesicles that are blisters, or a rash involving one dermatome on his or her body or face, what precautions would you need? In this situation, you should order contact precautions. If an unvaccinated child with a rash has fluid-filled vesicles and her school is in the midst of a chickenpox outbreak, which isolation precaution would you choose? In this situation, you would want to order airborne and contact precautions. And finally, if a patient has had 3 or more watery stools in the last 24 hours, or an acute onset of vomiting and or diarrhea, which isolation precaution would you choose? In this situation, you should order contact precautions. We've already reviewed how to quickly identify a contagious patient and how to appropriately isolate them. Next, let's talk about informing. Who needs to be informed? First, who should be informed of suspected or confirmed infections? Any other units receiving the patient from the emergency department should be notified so that all of their staff can take appropriate precautions. This includes trips to radiology for an X-ray and transfer to an inpatient unit. If you are transferring the patient to another facility, be sure to inform the receiving facility if the patient has an infection, even if it's not yet confirmed. This will allow the receiving facility to take appropriate precautions. Also, you may need to inform the emergency department charge nurse for high-risk infectious diseases, such as possible measles, Ebola, or tuberculosis. Next, you need to know who is responsible for informing these individuals. Be sure you understand and know the chain of command for relaying information at your facility. Never assume anything. The goal is to keep your hospital colleagues, visitors, patients, and other facilities safe. They cannot isolate the patient if they don't know. And lastly, who else might need to be informed? Depending on the situation and the disease that you are considering, the Infection Prevention and Control Department will help ensure correct isolation and decrease transmission risks. Your clinical infectious disease team will ensure that the patient receives the correct infection treatment. And finally, your local public health department partners should be notified if the patient has a reportable disease or if you have concern for an outbreak. It is important to know that select diseases must be reported to public health. Lab-confirmed cases and clinically suspected cases are reportable. These posters can be helpful resources and are free from the Oregon Health Authority. You can go to www.oregon.gov/OHA to find them online. How do exposures occur in the emergency department? Common exposures to staff are usually a result of incorrect PPE. Some examples can be a body fluid splash to the eye, nose, or mouth. This could happen if someone got coughed on or sneezed on while taking care of a patient with influenza or meningococcal disease. Another example of exposure would be direct contact with a symptomatic patient. If you were without gloves, touching a patient's rash with scabies, MRSA, chickenpox, or herpes will lead to an exposure. And finally, wearing the incorrect PPE for the pathogen that the patient has. Wearing a disposable surgical mask for a patient with tuberculosis would lead to an exposure, because protection from tuberculosis requires a fit-tested N95 mask or PAPR. So don't forget, identify, isolate, and inform. A rapid assessment should happen with every patient you see in triage. First, identify the contagious patient as quickly as possible. Second, isolate the patient to minimize spread to other people in the emergency department. And third, inform the appropriate team members so that the patient receives the best care and the patient is isolated appropriately. Now let's talk about some specific infectious diseases. Ebola virus disease is a highly contagious disease. It is associated with people who have recent international travel, especially to affected countries in Africa. Patients are most contagious if they have vomiting or diarrhea because of the very high amount of virus in their blood and body secretions. So how will you identify these people in the emergency department? First, to identify, you have to ask about travel. If you don't ask a travel history, you will miss it. Second, isolate the patient. Place the patient in a private room immediately. And finally, inform. With this disease, you want to contact your charge nurse and the infection control department immediately. Next, let's review measles. Measles is a highly contagious viral infection. Patients have cough, runny nose, and conjunctivitis, or red eyes. There have been several outbreaks in Oregon and across the United States in recent years. Most of the cases are unvaccinated individuals, meaning that they have never received the MMR vaccine. What do you need to do in the emergency department for infection control? To identify these patients, you must be aware of these symptoms, or you'll miss it. Second, isolate the patient. Place a mask on the patient as soon as possible. Place the patient in airborne isolation precautions. And don't forget to confirm that the room's airflow is negative pressure. And finally, inform. Be sure to immediately inform your charge nurse and also contact your infection control department. What exposure risks exist in Oregon? From 2001 to 2019, there were 130 pertussis outbreaks. The majority of these took place in school settings. From 2002 to 2018, there were 14 meningococcal disease outbreaks. Of these, there were 42 total confirmed cases, with a range of 2 to 7 individuals per outbreak. Oregon has seen 3 measles outbreaks, which have included 17 confirmed cases. During Ebola active surveillance in 2014 and 2015, there were 213 Oregonians who were being monitored after travel to Ebola-affected countries. We had no cases of Ebola in Oregon. And finally, there were 81 cases of tuberculosis in 2018 alone, and 60% of these cases lived in the Portland metro area. There are a couple additional concerns that may come up in the emergency department. First is pregnant healthcare staff and their risk of exposure. If these healthcare workers follow standard precautions with every single patient and take advantage of the PPE supply, they will be protected. It is important to note that many hospitals have occupational health program policies that are specific for pregnant healthcare personnel, so be sure to review your facility's policies. Also, it's important for pregnant healthcare staff to know their immunity status to specific diseases that are vaccine preventable, including measles, pertussis, and chickenpox. Agents of bioterrorism are rarely a concern in the emergency department. As long as the healthcare worker follows standard precautions with every single patient, the risk will be mitigated. Be sure to know your emergency department decontamination procedure. The next time you're in the emergency department, take a moment to look around. Do you know where the ED decontamination shower is? And lastly, if you do have a concern for an agent of bioterrorism, notify your local public health immediately if it is a concern. While working in the emergency department, be sure to stay alert. This way, you will protect yourself and others. Don't forget, a travel history is the only distinguisher between MERS, SARS, Ebola, and everything else seen in the emergency department every day. This will always be the case. When in doubt, add precautions. You can always discontinue them later. Don't forget, you are responsible for the safety of your coworkers too. And finally, always follow routine infection prevention practices. You can stop the spread of infections from your patient to other patients, you, and your family. This concludes our educational module on emergency department infection prevention in Triage. We would like to acknowledge and thank our partners in infection prevention for their assistance in the creation of this educational module, including Asante Ashland Community Hospital, Legacy Good Samaritan Hospital, and St. Charles Healthcare.